Today I'm going to talk to you about how it's our jobs and how me as an entrepreneur in our company hides some of that complexity and makes the system easier for patients without sacrificing quality. First, let's talk about how I got here. 10 years ago, I was diagnosed with ulcerative colitis and came face to face with a really broken healthcare system, one that I was being asked to deal with for the rest of my life. And since then, I have dedicated, I've been an entrepreneur, an investor, and an advisor in healthcare companies that are looking to make access to healthcare simpler, more affordable, and more convenient. I'm working with a number of companies you might know. I'm on the board of Parsley Health. I'm an investor in a number of companies like Everlywell, Mindbloom, and Standard Cyborg. Through this process, I've seen that the healthcare system is really not simple. And a big piece of that is that we are asking patients to coordinate all aspects of their care, their pharmacist, their doctor, all the other pieces, and they're shouldering all the burden in a really complex system. Now, all those pieces are really necessary. We can't just avoid a pharmacist. We can't just avoid a doctor. It needs to be part of care. But we're asking patients to navigate all of that, and on top of that, how they pay, their insurance company, rules and regulations, and it's really difficult. Let's look at just one use case and one that we solve with our system, and one that's being used by tens of millions of women in the United States a year, access to birth control. A woman wants birth control, patient wants birth control. They need to first find their insurance company, what kind of doctor are in their network. They have to schedule an appointment. They have to visit a clinic in person. They don't know how much that's going to cost. And they don't know, they might be new to this doctor. Then they have to coordinate with a pharmacy. They also don't know how much that's going to cost. And when they want refills, they're going to need to go back to the pharmacy. And when they want a renewal of that medication, usually every year, they have to go back to the doctor's office to ask for renewal, even though most of them will get the same medication or substantially similar medication. And that's why 70% of women report having problems accessing something as simple as birth control. Now, luckily, digital workflows are really, really good at simplifying this process by bringing all the information and all the communication between these stakeholders into one simple platform and view for the patient. A big piece of enabling that in today's world is removing the in-person requirement for care delivery. The CDC estimates that 417 million doctor's office visits per year can be done remotely with today's technology. And I think everyone in this room, and the reason you're probably here, you know that number is only going to increase. And I suspect that in the future, the vast majority of doctor's office visits will be something that you can do remotely. At SimpleHealth, we have a platform that's just like that. It's a digital workflow. And attacks, one of the products we have attacks the birth control use case I talked about earlier. A patient can fill out health information. A doctor will review that information asynchronously, usually within a couple hours, write a prescription for medication. A pharmacist then will review that information and send medication to the patient in their home, and then auto-refill that medication whenever the patient needs it to their home or another location if they need a shipping and information change. And then as long as that patient is a member of our platform, they have ongoing access through one single point of communication to pharmacists, doctors, patient experience agents, so that when you have things like insurance denials or credit card issues or the medication's not working, or they just have questions, they can actually get that kind of thing solved without trying to figure out where in the system they go. One of the sort of huge issues with the current system is if anything goes wrong in the sort of like the basic pathway, then the whole system breaks down and the patient is like left wondering, okay, who do I call? Insurance company, doctor, pharmacist? And they really like get stuck in that sort of I don't know what to do stage. And we help solve a lot of that. What we do is one step. But there's going to need to be systemic change in order for us to accelerate adoption of digital health tools broadly and telemedicine in particular. A couple of things that you want to highlight. One, there are regulations that prevent us from being with our sort of asynchronous model in about a dozen states. we're going to need to modernize the rules that don't just reward the initial companies in telemedicine that were doing synchronous live video and are rewarding sort of, we call it regulatory capture, but rewarding companies that sort of were in the initial room when the laws were being written. The laws really need to be modernized. Second, legislatively and also just government reimbursements, like we need to find ways to reimburse for telemedicine visits the same or similar to how we do for in-person visits. That way, people who want to use online services aren't being penalized financially, and we're not creating a system where the people who have money to afford cash pay medications and cash pay services go online for better service, and the patients who really need the freer services that are being reimbursed are going into, the traditional clinic system, which is potentially worse care and more inconvenient and harder for them to access. Sort of like a self-fulfilling prophecy where we're making the problem worse. And then do things I think are very specific to this room. One, we need to have more diagnostic tools that are being designed for remote care. We need the kinds of systems that doctors have access to in an office visit. We need to make them mobile. We need to make them something that patients can use on their own. That way they can plug into systems like ours and Roman and others where you have the care platform and just need new types of technology to unlock new types of care. And then we also need for physicians and physician groups to start looking at standard of care and clinical guidelines and not just writing them for in-person clinics, saying like, well, if we're going to deliver this kind of care, then it has to include this one thing, and that thing happens to be something that is a little unnecessary or maybe like optional, but only happens when you're in person and can't be done remotely, and sort of creates barriers to like finding ways to use care online. So that's all I've got for you. Now time for some questions.
Future of Care is New York City's premier community for healthcare innovation. To learn more, subscribe to our channel and visit our website at futureofcare.nyc.